Hello everyone, my name is Olga Tangsi. Welcome to this week's discussion. This week I will talk about disaster mental health response following an active shooter incident in a school setting, specifically how mental health counselors can support students, faculty, and staff in the immediate aftermath. This discussion is grounded in evidence-based disaster mental health practices, including psychological first aid, trauma-informed care, suicide risk awareness, and even a brief biblical intervention for those working from a faith-based perspective. Strategies from this week's readings and presentations. In responding to an active shooter incident in a local high school, my approach as a disaster mental health counselor would be guided primarily by community-based psychological first aid as outlined by Jacobs. Psychological first aid focuses on practical, supportive, and humane interventions. The goal is not for therapy or diagnosis. Instead, the priority is safety, stabilization, and connection during the immediate aftermath of the disaster. In a setting like a school gymnasium, this means maintaining a calm, non-intrusive presence, clearly explaining my role as a mental health counselor, asking permission before offering help. Research also emphasizes on the importance of trauma-informed, developmentally appropriate, and culturally responsive care, especially when working with adolescents. According to Stepnicky, teens may show emotional numbing, withdrawal, shock, or agitation. These are normal trauma responses, not signs of pathology. Applying these principles help prevent re-traumatization and support psychological stabilization during the acute phase of the response. Scholarly and evidence-based strategies. Scholarly and evidence-based resources consistently emphasize that disaster mental health response should be triage-based. Mental health counselors should coordinate with the medical team, law enforcement, and school administrators rather than entering the scene and assuming authority or expertise, beyond their own role. Another key strategy supported by the literature is avoiding premature emotional processing. Jacobs cautions against psychological debriefing. Instead, counselors should listen only when survivors choose to share and give permission. Forcing people to relive traumatic experiences too early can actually increase distress or stress. The literature on suicide intervention, both for adolescents and children, also stresses the importance of monitoring risks without rushing to diagnosis. Symptoms like emotional numbing, hopelessness, or expressions related to death require careful observation. Immediate intervention is necessary only when there is an active suicidal intent. In mass trauma situations, caution and clinical humility are extremely essential. Strategies used or observed in practice. In real-world disaster and crisis setting, I've used and observed several strategies that are especially effective after trauma. These include grounding, regulation techniques such as breathing exercises, sensory awareness and exercises, quiet, supportive presence, like sitting nearby and just offering a bottle of water or offering help, encouraging the survivors, especially when they are teenagers, to stay with trusted peers or staff. Adolescents may openly express sadness or fear. Emotional numbing is often more common than crying or verbal expression, and that's important to recognize as a response, as a normal response. Being calm, patient, and developmentally sensitive makes a significant difference. From a biblical integration standpoint, from a biblical perspective, disaster mental health care aligns closely with the call to compassion, presence, and restoration. Romans 12:15 reminds us that weep with those who weep. This mirrors psychological first aid, emphasis on being present without forcing, an explanation or emotional processing. In moments of mass trauma, the most meaningful response is often showing up, staying near, offering comfort rather than trying to fix or explain suffering. In conclusion, effective disaster mental health response after a school shooting emphasizes or prioritizes safety, stabilization, connection, respect for survivors' autonomy, grounded in evidence-based practices, guided by compassion. Disaster mental health counselors play a critical role in supporting immediate recovery while minimizing the risk of long-term harm. Thank you so much for watching. Enjoy the rest of your week, and I hope to see you soon again.